At this station I'm going to show you how to apply a modified Robert Jones bandage to a dog's foreleg. Well, first of all we're going to select the material we need for our bandage, which we'll start off with our non-adherent dressing, which will be the inner contact layer of the bandage against the wound, and that will be held in place with a wrap of the soft band, which is a nice conforming soft bandage which won't have any risk of causing pressure sores. And then we'll build an absorptive and supportive layer using cotton wool, and the cotton wool is a lot easier to wrap if we break it in half, if we can. Some cotton wool break easier than others. So just dividing it like that, and the cotton wool will be tensioned against the limb with these elasticated conforming bandages, which we have a choice of the knit fix or the slightly wider one, but either of these will be fine. So we'll just take a roll of knit fix, but we're going to use a few rolls of that, and then we'll hold our bandage together at the end with this sticky elastoplast, which will be our outer layer. Okay, remember it's important before you're handling patients and doing a procedure like this to wash your hands in some sort of antiseptic wash. And we're going to start our bandage with this non-adherent dressing. And remember, this dressing has a shiny surface, so this polyethylene perforated shiny surface which is going to go against the wound. So it's important to handle the dressing by the other side and not touch the contact surface. So we're going to have our assistant help restrain the leg. We've got this dog in lateral recumbency, and have our wound covered with our non-adherent dressing, and that's going to be held in place with this soft band wrap, which can't really be wrapped too tightly because it would just break. It's not a strong material. And just overlapping this bandage half at a time, wrap up and down this leg. We're going to take this bandage to just above the elbow. Just to stop this patient getting sores between its digits, we're going to put these little pledgets between the digits down here. So we're just using pieces of cotton wool for this. And continue our soft band wrap in the same direction, down to the level of the second and fifth digits here. Okay, for our supportive and absorptive layer, sometimes called the intermediate layer of the bandage, we're going to use cotton wool. And we're going to wrap this from distal to proximal, again overlapping approximately half at a time. Okay, so we've put 2 layers of cotton wool on this bandage so far, and depending on the amount of exudate that's coming out of the wound and the amount of support you need, you can increase or decrease the thickness of the bandage. And a full Robert Jones actually has 7 layers of cotton wool and gauze wraps. So once you have sufficient intermediate layer, we're going to hold that together with our outer layer, and for that we're going to use this adhesive elastoplast. Remember, we brought this bandage down to the level of the 2nd and 5th digits, so we can still see the 2 toes, so that those can be checked for swelling or coldness if the bandage was too tight. And we're going to wrap this elastoplast layer from distal to proximal. Actually, remember to keep your bandage in the same direction. And again, we're going to overlap half at a time, which is easy with the elastoplast because it has a line down the middle. And you can see that it's quite tight to unroll the elastoplast, so sometimes it helps to unroll it a bit first and then apply it so that you're not getting it too tight. Note how we're not going to take the elastoplast any higher than the cotton wool so that it doesn't cut into the dog. You can see how it's quite difficult to unroll the very last part of the elastoplast. Sometimes it's easier just to cut that off. So that's our supporting modified Robert Jones bandage applied, with our toes still sticking out.